Good morning, everyone, and welcome to this live streaming for the public session of the Oversight and Engagement Board for today, which is the 29th of April, and it's just about 10 past 5 past 10. That's my dyslexia kicking in nicely there. Sorry, apologies. If it was 10 past 5, we'd all be very wide. It would have been a very long day. Apologies. So this meeting is live on YouTube, obviously. We'll come to the minutes from the previous meeting, which was held on the 1st of April, which seems like a long time ago. I hope everyone's happy with those minutes. I'll assume they are. Unless anyone sticks their hand up, the little blue hand, that would be great. Excellent. So we come straight on to the weekly surveillance report from our Director of Public Health, Lucy Whiteman. Thank you, Lucy.
Thank you, Councillor Morris. So we're going to bring those slides up for you. Sorry, I was just muted by the host. We're having some techie issues this morning, aren't we, Ian? So this is last week's surveillance report. So it covers data up to the 18th of April. I have to be honest, we have made significant progress in the county. We, as you know, have had some areas with significant continued and enduring transmission, but it is very much a positive and downward trajectory at the moment. So really, really good news, and just really demonstrates how people are adhering to the regulations and also just getting those tests on a regular basis and getting those vaccinations when they're called. So great news. And in that week up to the 18th of April, we had 285 cases reported. At that point, Corby still had one of the highest case rates, but that has significantly reduced even further. So let's get on to the first slide if we can. So obviously we are still going through the lockdown release process. Now, obviously this is going to be driven by data and not dates, but we have got some target dates that the government have laid out for us. We obviously are at step 2, and we have seen in April a lot of non-essential shops and services reopen, funerals and weddings obviously start to be able to have more attendees, and hospitality venues serving people outdoors. So really good news. Rule of 6 has now come in as well. If we go down to the next slide. Obviously, all of these things are completely reliant, as I said, on us doing whatever we can to mitigate risk. We have provided locally a number of services that we would continue to ask people to engage with. So we've got advice through our environmental health and public health teams. We've got lateral flow device testing for people who don't have symptoms. We've got PCR testing sites for people who do have symptoms. And we've obviously got a number of sites that can provide you with a vaccination when you are eligible. So if we do want to continue to not only have the newly found freedoms that we've been enjoying since the 12th of April that are outlined here, but also all of those outlined in the next steps, we do need to continue to engage in those, as well as obviously maintaining our distance when we are out and about, using face coverings whenever we are indoors, and obviously just continuing to use that good hand hygiene practice, because it's those simple but very effective things that will keep us on this track of downward case rates. If we go on to the next slide. So we've got some new comms. People obviously are out and about doing things, making sure that really they understand what those new rules are, just giving some tips and advice to keep themselves safe in those new settings and being able to undertake those new activities, and reminding people that obviously the rule of 6 is 6 people can meet in particular areas, or 2 households, and those households can include whoever might be in a support bubble. So really just trying to make sure that people do know how and when each of those steps changes. If we move on. If we go down to the first data page, is that okay, Cheryl? So really good news. We are still seeing that downward case rate reduction. And obviously, we can see it's really started to make a difference to the numbers. Back down now into the low 200s and 300s. Really, really positive progress. If we go on to the next slide, it gives a breakdown from a point of view of our areas. Now, Northamptonshire as a whole is still statistically significantly higher than the April rate. Just to give people an idea, that England rate at today is actually 24.8. So, you know, really very low and very good news, but it does show we still have got some catching up to do. In Northamptonshire, at the point in time this data was produced, their case rate was 46.8. That has reduced further and continues to reduce further. So the data from 2 days ago, which is the most recent data that I've got, she says, flicking through her book, the case rate for Northamptonshire had actually gone down to, she says, trying to find it, 34.8, which is really good news, and West Northamptonshire's was down to 34.8. So again, significant progress. You can see all of the borough and districts were still going to continue to report those, and actually Corby's has considerably reduced further. If we go down to the next slide. Again, really good picture, really good visual illustration of how we are starting to move down. You can see at this point in time, Wellingborough's case rate was higher than that of Corby's. Corby's is now the 4th highest rate out of the 7 boroughs and districts. So as I said, really amazing progress and demonstration of, you know, resilience and you know, commitment by the people of Corby, just getting those case rates down as they have. But broadly, you can see the other thing is we're starting to catch up with that Northamptonshire and the overall England average. So really, really good news. If we move down. Again, you can see any line below the middle 0 line is good news. It does mean a reduction. You can see in the last 7 days that those blocks are bigger, and that means that obviously our progress has been greater. So we just need to keep on that trajectory. If we go down to the age breakdown, you can still see that we are going to be affected by schools reopening. Obviously, the setting is difficult for people to continuously socially distance. And again, you know, children understandably are finding it more difficult to socially distance. So we are going to continue to see 0 to 19 age case rates remain relatively high compared to other age groups. And again, we're still seeing that working age adult population, particularly the 30-39-year-olds, have some continued transmission. We do recognise that that is, you know, a group that are likely to have to go physically into work, but they are also quite likely to be the carers for those children in the 10 to 19-year-old age group. So you can see the epidemiological link there. And it does just reinforce that, particularly with household transmission, that regular testing, particularly if you've got children in secondary school, of all of the household members is going to be key to identifying when people are positive and getting them isolating so that they're not infecting anybody else. If we go down, please, Cheryl. If we go down, obviously good news from a point of view of case rates in hospitals, and equally if we go down, from a point of view of deaths, again, good news. Northamptonshire only saw 4 deaths in the last 7 days up to the 18th of April. Obviously, that's still 4 more than we would want to see, but I'm sure people will appreciate it is good progress. If we move down. So again, this is a part of the picture from a point of view of education settings. So we are still seeing, obviously, a number of education settings be affected by COVID positive cases, and that is really good news in a way that we see that people are being identified, because that regular testing is helping us make sure that when we do identify a case, that the impact is minimalised within that setting. Indeed, the bubble process that they are obviously using in schools as well helps protect, you know, wider classes and years. So it is really good news that we've got really good engagement with that testing process. It understandably will have some impact on pupil attendance, but people have obviously recognised that it's the right thing to do and are engaging very well in that. The important thing is, because we've had no large outbreaks in school because of that testing process, we have got no education settings closed at this point in time. So that's great news. And again, I just want to say thank you to all of the schools and all of the staff and all of the pupils and families who are supporting that process. It really is going to be key to us continuing to progress through the next few weeks and the next steps out of lockdown. If we just go down to the outbreak situation. Again, this is a really good news picture. I'm sure people can remember when we had, sort of 50, 60 outbreaks in, a 7-day period. The summary of outbreaks up to the 19th of April was that we were just dealing with 5 active outbreaks at that time. Yes, they are still, roughly 10 or more cases per outbreak. Some indeed are bigger than that in workplaces, but it does just demonstrate, as I've said before, the benefit of regular testing. It means that we can identify a potential outbreak early, and then obviously isolate those that may be at risk of having been exposed. You can see obviously from the numbers there that the vast number of cases are associated with a couple of significant workplace outbreaks. So really good news, and we're obviously supporting those settings to continue to not only work in a COVID secure way, but as I said, also engage their employees and anybody else who might work in a particular setting to get that regular testing. So if I stop there, Councillor Morrison, just take any questions.
Thank you very much for that run through. Very, very good figures. It seems to be an improving situation, which is great to see. I'm looking around for questions. There don't appear to be any, in which case do you want to move on to testing and contact tracing update? Thanks, Lucy.
Thank you. And again, we've got some slides to share if that's possible, please, Cheryl. So again, this is one of the good news stories locally. We've been working in partnership with the National NHS Test and Trace process now since August last year. And we've got the second highest contact tracing performance rate out of the East Midlands, with only Rutland being that tiny little bit ahead of us. Bearing in mind the significant numbers of cases that we've had compared to somewhere like Rutland, that is an extraordinary achievement. And again, we just thank everybody who has engaged in that process to help us identify people who may have been exposed to a positive case and help give them the right information and advice to isolate and break the onward chain of infection. Broadly, if we go on to the next slide, we can see that obviously our number of cases that we're having to follow up within the local team is reducing, and that is because our overall case numbers are reducing. Really good news, but again, well done to that team, because you can see over the period of this year, certainly since Christmas, they've had some, staggeringly high case numbers to contact trace and follow up. And they've done an extraordinarily good job making sure that everybody understands their position, their exposure, and has got all the information that they might need to help them self-isolate. And the councils continue to offer that self-isolation support throughout their isolation period. If we go on to the pie charts, it just shows a breakdown of how those cases obviously are followed up. You can see the large number of cases, in fact, that the national team still are picking up on our behalf in the first 24 hours of being notified. Of those that we follow up locally, we're now also pleased to see that the number of people refusing to disclose any contact information is reducing. It's now down to 7%. Obviously, the more people we're told about who may have been exposed, the more we can contact them and give them advice about isolation and about the need to do so to break that onward chain of infection. So just that reminder, please do obviously engage with us if we contact you as a case or as a potential contact. If we move on to our testing sites, this is just a bit of a reminder about the location. So if we stop on this one, these are the PCR testing sites for these people who have got symptoms. As I said, they have been there now for quite some time. South Northants has still currently not got a static local testing site, but it does have a mobile testing unit, and that tends to make its way around Toaster area and the Brackley area. So at the moment it's in Tove car park in Toaster. If we just jump down to the data, the information about the, if we keep going, so this is the lateral flow device testing site. So this is for people without symptoms, and we're recommending obviously that people get tested on a regular basis twice a week. So these asymptomatic testing sites, as they're called, ATSs, again are scattered across the county. You are able to also collect test kits that you can then do at home from these sites. So this is obviously going to be a really important feature of how we continue to identify people who might be infected but didn't know it, and obviously help us reduce any further outbreaks and indeed keep that case rate low. If we go down to the next slide, Now, we've got lots of information here about opening hours, number of staff that are there, number of tests that we've administered in the last 7-day period. I think one of the things to note here is we've still got low site utilisation. We've got a lot of capacity to do more. So I would be encouraging everybody who doesn't want to test themselves at home, or who doesn't have access, to test kits for whatever reason, or would prefer for somebody to help them, to use these sites. They are there to obviously help support and identify anybody who might not have symptoms but might actually be infectious. So please do utilise that. Lots and lots of capacity still in that service. And as I said before, you can also just pick up your test kits if you do want to take those home and do them yourself. And Councillor Morris, you reminded me earlier, your people can obviously also register online to get test kits delivered home. Lastly, just one other relatively new aspect that I think is worth reinforcing is the pharmacy click and collect opportunity. So we now have a huge number of pharmacies on high streets where you can collect your test kits as well. So pharmacies themselves don't do the tests. So it's that previous slide that shows you where we can do the test for you. This is simply just to collect the test kits if you want to do them yourself at home. Again, we've tried to make sure that we've got as many pharmacies signed up to do this so that it's as easy as possible to access those test kits and be able to do them twice a week in the comfort of your own home. 121 sites engaged, and again, thank you to all of the pharmacies who have supported this endeavour, scattered all over the county. So if you do, excuse me, want further information, you've got a link at the bottom of the slide there. And all of that information is available still on the Northamptonshire County Council website, which will continue to be live for some time with all of that COVID information. Thank you, Councillor Morris.
Thank you very much. Some really good stats in there. As always, it's great to see that we're doing well. It would be nice for us to beat Rutland, but they are much smaller, as Lucy points out. Therefore, we can take a small victory from that based on the size of our county, I think. But it's not a competition, of course, but it's always good to see us doing really well compared to our nearest councils. I've got Chris Stamper's got his hand up. Chris.
Thanks, Ian. Just wanted to say a couple of things. Firstly, the test and trace thing that local councils are doing and the local organisations are doing, I think just shows how that extra level of test and trace really does add to the system, and how that, there are some things that we can do locally better than the government can do nationally, in terms of, that extra bit of work. So that's brilliant, and it's good performance. Also great to see Corby's figures coming down, and I hope that it stays that way. I haven't fully appreciated, and maybe lots of other people don't fully appreciate this either, that there is almost there is an encouragement now, isn't there, for people to get themselves tested with a lateral flow device on a regular basis, whether or not they think they've got symptoms, because they may be asymptomatic, because that is now part of the fight against the virus. And I think it's really important that people fully understand this message. The facility is there. You can see that, the testing sites aren't that well utilized, but that's probably a good thing. But, go and get tested is the message, isn't it? And you can do that in the comfort of your own home. So I think, we need to ensure that message goes out from this meeting today, and when we're talking to people in the next week, as we might be, that we put that message forward, because I think that's important. It's not really a question, I'm afraid, Ian, but it was something. If I hadn't fully got that until very recently, then it's not surprising other members of the public haven't either. Thanks.
And you're absolutely right, Chris. And I'm sure Kath will probably pick up some of that in her comms update, which we're coming on to. But I think absolutely testing at home or in these centres will become a very important weapon in the arsenal against COVID-19 going forward. And I think it has to become, as you've said, Chris, something that we all undertake as part of normal life. And until everyone does that, we might have issues further down the line. So it's good to get that message out. Thank you, Chris. I'm going to pass now to, unless Lucy, did you want to comment on? No. Okay, brilliant. Thank you. So I'm going to come to Kath Hall now for a comms update, and I'm sure she will pick up on the changing in messaging that we probably will need going forward. Kath.
Hi, thank you very much. Yeah, since it's been a while since our last meeting, just to update on a few of our major pieces of work. So many of you will have seen our latest campaign called Take Care in the Open Air, which we launched in conjunction with step 2 of the roadmap out of lockdown. So that is to help people as they start to meet outdoors to still take care when they're in the open air. So socially distancing, continuing to wash hands regularly, wearing face coverings where appropriate. So hopefully you'll see signage across buses, bus stops, social media. If you've seen our digital vans or iWalkers, they'll be on those as well. And you will also start to see them in open spaces, parks, more public areas as well. So that's quite a big campaign. We're not quite prepping for step 3 yet because we're still waiting for further details from government about what the detail is in that, but it's on our radar. And obviously, as soon as we have more information, we'll start to get that underway. Town centres have also got new signage. So anyone who's been into the town centres should be seeing that signage. Again, that's mainly hands, face, space, guidance, and also directions, queuing, all of those kind of posters and the little roundels, the round spots on the floors to help keep people safe and spaced, especially when they're queuing for pubs, shops, restaurants. As mentioned, testing is a big part really of our future. Testing is available, lateral flow device testing, so the regular testing of people with no symptoms is available in many, many different options now. So you can click and collect. You can collect them from pharmacy sites. If you're in a bubble with someone who goes to school, primary school, secondary school or college, you and your family / household bubble can get access to free test kits. Well, anybody can basically now. So, and you can order them online, and as I've done myself, they come the next day. So it's very quick. And it's quite easy. You can just take them and then just register your results. And it's great peace of mind really for knowing that if you're meeting with people, but it's still important to remember to wash your hands regularly, keep your distance and wear face coverings. On top of that, we still continue to do a lot of work with our ethnic minority communities, BAME groups. So we're currently in Ramadan, a big Muslim festival. We've been giving a lot of guidance to the Muslim community about celebrating safely, and also the fact that taking up the vaccine during this time is safe to do so. Ramadan ends on the 13th of May with a big festival called Eid. So we're just sharing some assets with community members about how to celebrate safely there. We've also got Orthodox Easter this weekend, 2nd of May, which is celebrated by a lot of Eastern European communities. So there's a lot of work going on with community leaders and church leaders in those Eastern European community groups. That work's actually helped us to understand a little bit more about some of the misinformation in those groups, some of the vaccine hesitancy that's coming up. So we're continuing to work with those groups and those people to understand what the issues are and develop some comms to overcome that. We're doing quite a bit of work. We continue to do quite a bit of work with our young people. So we've still got our young influencer, Tessa, who's got around 6 million followers. She's really helped us with some testing videos. They're on the Public Health TikTok channel. So do give that a watch. They're really good videos in how to actually take the test safely. So if anyone is taking the tests and doesn't know quite what to do, she explains it really well in quite a nice way. She's also done some social distancing videos for us as well. And we've got some competitions for young people that are live at the moment, and a conference was held this week. And I know the local media are helping us to share all of that. So thank you for that. And just in addition to the work with the Eastern European communities, there continues to be work with other BAME groups, some question and answer webinars and sessions just to help people understand and ask questions about the vaccine, any kind of hesitancy or myth busting sort of sessions. So we're continuing to develop those sessions and answer people's questions. That's probably the main summary for me.
Thank you, Kath. Very interesting what's going on in the comms team as always, and it's interesting to see how you're developing the lines as we come out of lockdown. So thank you for that. As always, the hard work continues and will continue for some time to come. I am looking around for some questions. I don't appear to have any. I would just say that I have ordered tests for home as well, and they came very quickly. And although I haven't used them yet because I haven't needed to, because I haven't gone anywhere, they are there ready and waiting. Although I am slightly nervous about using the the throat and the nose thing, but I will watch that video because I do follow on TikTok as well, the influencer that you referenced there. So I will watch that before I take my first test. Anyway, I wanted to say thank you very much, everyone. I think the next future meeting is on the 27th of May at 8:30 a.m. I wanted to thank Cheryl for her hard work in the background, keeping this all going, and everyone else for attending. So thank you very much, everyone, and I'll see you all soon. Good luck with the elections, etc., that are going on next week.
And have a great retirement, and we'll have a coffee, and then you can use your test kit before.
Yes, indeed, I will do that. Thank you very much, Jim. So I'll say
just reiterate the same things you've said. These briefings have been amazing, as has the local response been amazing, and it's also been brilliant to be able to pass that through social media when we're allowed, and I'm sure everybody in every council has been able to help. But all the very best for whatever the future holds for you.
Yes, and thank you so much, Councillor Morris, for your support. It's been an extraordinary year for all of us, and I'm sure you didn't think that this was what you'd be doing as the portfolio holder for public health either last year. So thank you so much for all of your support from all of us. You've been brilliant. Thank you.
Yeah, well done, Ian.
And again, thank you, Cheryl. Really, she's honestly the person who's kept the wheels going. I'd lost all the details for this morning, and I had to call her at 7 o'clock, and she very kindly resent them all to me to assuage my panic, which was growing at a vast pace at that point. So, and I know we've all had a lot of IT issues this morning, but thank you very much. I think it's been really helpful. These have been it's been an honour to chair these meetings. So I look forward to seeing you all in another guise. I'm sure I'll crop up somewhere. And sure. Take care of yourselves, and I'll speak to you soon.
Thank you. Thank you, Cheryl.
Bye-bye. Bye-bye. Thank you.
Cheers,
bye, everyone.